So I'd like to welcome our listeners to this special show because we are doing it on videotape, which is unusual for us so far. But I recently had the pleasure of meeting Patty when she actually called. Some of you may know that I am a consultant for the Medcovet Luma. And Patty was interested in this technology, using red light technology for her boxer, Zeke. And so we're chatting, and immediately I could just tell her warmth was exuding, through the technology. And she was so passionate about the love and care and wanting just the best for her pets. And as we were talking, Patty disclosed, why she was interested in perhaps using the Luma. And one is that Zeke has a lot of anxiety. So she wanted to be able to use a tool at home, which the Luma is great because, again, it puts the power of healing in the pet owner's hands. And he'd recently been diagnosed with degenerative myelopathy. And we all know how devastating getting that news can be. And so Patty was still kind of going through ascertaining if it was indeed DM, because a lot of times it's a diagnosis of rule outs and things. And if you haven't listened to our show with Phoebe Hart and her dog Hugo about degenerative myelopathy, it's a lot of work and it's a challenge. But these pet owners that Kathy and I have the pleasure of working with are so committed, and it's just great. I don't even think I'd gotten to the point of our screening questions when Patty was telling me the story of Zeke and mentioned that he's a cancer survivor. And in fact, I'm sure she'll tell all the details as we get going, but he's had surgery 5 times.
Actually 6 now. Yeah.
Oh, 6 times.
Once this year. Yeah.
Yeah. To remove, tumors and so on and so forth. And that was a red flag for me, because one of our screening questions with the Medcovet Luma and any light therapy or laser is no history of cancer. And the reason for that is that this technology, this tool, the light, actually causes things to grow. So when we want things to heal, of course, we want blood flow and we want scar tissue to develop, and we want to heal as fast as possible through growth and putting energy into the body so that it can heal. But in the case of cancer, then you don't want to be adding that type of energy to the body, which could then cause cancer to spread, or, unwittingly, putting it over a tumor or something that just hasn't been found yet.
Right.
So we talked about that, right, Patty?
We sure did.
Said, well, this has been quite a journey, and I actually wanted to give back. And so I started this campaign, which I'll call a public service announcement, about checking your pups for lumps and bumps. And I'm like, well, tell me more about that. And so she briefly did. And then Patty, with her kindness and big heart, sent me a little package as thanks. And I got this cute little postcard. I got a sticker of Zeke and Zella, and we'll be talking about them a little bit more, and this magnet.
Yeah, I'm going to need that. I'm going to
get your address. That's on my list.
Yeah.
Look how cute they are.
So anyway, I was just overwhelmed with the joy of our connection, and being able to talk with Patty that day. But the funniest thing is, maybe we were 3 sentences in, and I said, I wear many hats, and one of them is a consultant for Medcovet, but I also have a podcast. I didn't even say the name of the podcast, Kathy. And Patty says, wait, are you Chris of Kathy and Chris? And I'm like, yeah, I had no idea.
Diehard fan.
I had no idea who I was talking to.
Where she lived. I've come to learn that we're in her top 3 favorite podcasts. She's listened to most of our episodes. And then she starts fangirling about Kathy. And I said, no, you can't do that. Kathy's a narcissist. This is just her ego will just get super inflated, which is absolutely not true. Kathy is very, very humble. But Kathy already knew of Patty through. Take it on, Kathy.
Yeah, I actually know Patty because I follow the Zeke and Zella on Instagram. And honestly, I was just scrolling one day and I was like, oh, look at these two beauties. I hadn't even read their story. I'm like, follow. Right? And then of course I got more, in depth about what their story was and how she got Zeke and Zella. And I'll tell you that I was, watching the video. Patty had sent us a link to a video of the two of them, and and Zeke's story of how she got him. And I found myself actually sort of sobbing a little bit. Like I could feel it coming up. I know I'm welling up when I'm, thinking about the video, because just
Kathy,
thinking,
you act real tough, but you're a softie.
I know. I just started thinking about Zeke's ability, his resilience, his ability to forgive, his ability to trust in a person again or a human again. It's giving me goosebumps to think about it.
Same.
And and the fact that he's like, the fact that he's forgiven and that he can be a part of a family who absolutely loves him and adores him for exactly who he is, hearing or not, right?
Right.
He's different, but he's not less. He's just different.
Right. That's right.
Yeah, we haven't even mentioned that he's deaf yet.
Oh yes, that's right. And he's deaf, which oftentimes happens when you have in this a gene in these white boxers, and sometimes they're deaf, sometimes they're deaf. Yeah. But and then I think about him being abandoned in a trailer and how frightening that must have been for him, and the fact that he's missing one of his primary senses must have been very frightening for him. So his ability to rebound and form relationships with humans, and then his new best friend Zella. I mean, how great is that? So it was a real feel good. I mean, I kind of sobbed a little bit. I wanted to reach through the screen and smooch him, just like, you're a good dog. So I'm interested to hear, what more about his story. I'm really interested to hear about your campaign about check your pups for lumps and bumps, because as a veterinary technician, I think this is a fantastic campaign. How great would it be if we could catch these bumps early and get them off or diagnose them for what they are. And those are always going to lead us to better outcomes, right? If we can catch these things early. So I think this is a fantastic campaign, and I would love to hear more about it and how you go about checking your pups for lumps and bumps, which is a great saying, but it's hard for me to get out.
Yeah.
So tell us about Zeke's story, and of course, Zella, sweet little Zella.
Okay, do you have a few hours?
I do, yes, actually. I've committed my whole day to this, yes.
Well, thank you, first of all. It is such an honor. Gosh, the story really begins with, in 2019, I lost my white boxer. Darn it, I said I wasn't going to do this. Gideon in 2019 to lymphoma. And I thought, never again. I said the thing we always say, we're never doing it again. Get dogs, they're too painful. And then when you remove yourself and realize that it isn't really about us when we have a dog, it's about them and giving, an innocent being that needs a home, needs rescuing. Put your pain and stuff aside. It doesn't trump the need out there in the shelters, or rescues. So 63 days later, I adopted Zeke, and he's still a very anxious boy, but if his anxiety level was a 12 in August of 2019, I would say it's a solid 4, which is remarkable. I mean, he would never be crated, never. And now he goes into the crate on his own. He's right, and I got two crates next to each other. They're huge. They're like hotels. People say, "Oh my gosh, that's better than a hotel." They're not the wire crates, but I'm very fortunate to be able to give him a life, and I'm honored to be able to give him a good quality life. And a lot of times when we intend on, whether we're volunteering at an organization of any kind, or we're helping a friend in need or a neighbor who had surgery, or whatever, we do that to help them and the cause and whatever that is. But oftentimes, I would say in every case, for me anyway, we're the ones that walk away blessed, fortunate, encouraged, overwhelmed with joy,
Inspired.
and
Yeah, inspired.
reminders of how
Yeah.
privileged we really are. And it ends up kind of being a real wake-up call when you see others in a position of need and you realize, wow. Zeke has just taught me so much about how to survive and overcome, and like you said, resilience. He exudes resiliency, and that has helped me overcome my own severe traumas. And I'm indebted to him for that. To learn to trust, to be on a podcast and put my face before 2 years ago, I would have never done that. I wouldn't even have entertained it. I wouldn't have even probably had the courage to reach out by email and send an inquiry to Medco Vet. And then when she said, "Oh, I want to do a Zoom," I was like, oh, well, never mind then. That's okay. That's okay. I'm good. You have anything you could mail me? So, a lot of that I attribute to Zeke giving me that courage.
Sorry, Patty, I didn't mean to cut you off, but it's life-changing, it's life-altering. And I think that we underestimate the power of the love and the unconditional love that we get from our pets. And it gives us the strength to power through, right?
Yes.
To get through things. And it really is a blessing to be able to have any pet. Whatever your pet is, cat, dog, chicken, I don't care.
Yeah, right. And we're the ones who end up, we think, oh, we're all going to go rescue this dog or cat and help them and give them a better life. And it's like, you know what, really, I think I'm the one that's getting the benefit here. Like life changing, as you said, literally life changing. Coping mechanisms are different now. Everything are.
Right. So Patty, can you tell me this? I'm really interested. I know you adopted him and he had been abandoned in a trailer and they had already determined that he was deaf. And when you went to get him and took him home, how did you communicate with him? Can you just explain a little bit about your ability to train or communicate between each other since he can't hear you?
Yes, he was with a rescue that had pulled him from the environment for a very short time. He was at the rescue. And what's remarkable is that within 2 hours, I can teach him a new sign and he has it down. So they did, and they're the ones that told me that. So he came with a few signs already. And then I quickly learned, oh my gosh, he's picking up on this so fast, like eat. And in the morning for breakfast, teaching him eat. And then by dinner time, I'm doing that. And he's like, okay, let's go eat. It's crazy how fast they pick things up.
So Patty, let's get to the root of it. Tell us how you got here, why this is so important to you, and how you are paying it forward.
Okay. Well, I mentioned the loss of Gideon to lymphoma. And at the time that the mass was found on his neck, it was the size of a golf ball. And I'm one of those parents who easily can, be guilted about, what did I do? How could I have stopped this? What can I do better? How did this happen? So he died a week later. And it was just life. It was awful. It would just totally turn my world upside down. And then I got Zeke a few months later. And about a year, it was actually 13 months after having him, I found the smallest lump that most people would have probably ignored. And it was about the size of a pea. Really looked like, should I? At this point, I thought I'm really I'm hyper vigilant here. But then I thought, well, just do it. And I was blow drying my hair, getting ready for that vet appointment. And I thought, you know what, just cancel it. You're being ridiculous. This is not anything. Cancer doesn't look teeny tiny like that. And I am so glad. I will never forget that moment. I took him in. They did surgery that day, and it was a grade 2 mast cell tumor. The tiniest, most inconspicuous thing that most of us would say, I'm going to keep my eye on it and see if it gets bigger. Well, in my experience, I want to back up for a second. I'm not a vet. I am not trained in any way, shape, or form to give advice or anything like that. I am just conveying my experience. So what I have, and what I've been told by Zeke's vet to do. So, so that told me, being on top of things and doing something when you see something. And at the time I did not know about Dr. Sue Cancer Vet, but she has a campaign that is it goes see something, do something, why wait, aspirate. And I mean, there is no better advice that I could second than that.
We should get her on the show because we haven't interviewed like an oncologist or anything like that yet, but that sounds like a fantastic.
She's a wealth and generous with her time, her YouTube. She's very generous with the amount of education she puts out there for pet parents. I've garnered a lot from her, and I'm very grateful for her time and you know what she does, her commitment to helping parents. So 11 days later, after finding that, so he had surgery. That was rough. He didn't do well. It's the first experience with anesthesia, aside from him being fixed whenever that was. And then 11 days later, there was another one. And I thought, there's no way. It doesn't happen like that. And this one's even smaller. So I thought, well, okay, just take him in. He needed to go in for suture removal anyway. So I'm like, can you see, was that anything? Well, and I back up first on the first one, and on the second one, the vet did a fine needle aspirate. Super simple, not very expensive in terms of getting an immediate answer right now, because they poked them both, the first one and the second one. When they poked them, they looked under the microscope right then and there. Yep, there were the purple degranulating cells, and that was indicative of. Now, as Dr. Sue says, nobody, no vet, no expert can ever look at a mass and tell you that it's cancer or not. The only way is with, through biopsy.
Mm-hmm.
So
I just tell the audience too that these aspirates, I've been a technician for 35 years. The first step is to aspirate these bumps, and the pets actually tolerate it so well. And so I know it might seem scary for us to say, hey, we're going to take a little needle and we're going to stick it in this lump and we're going to suck some cells out. But I will tell you that they really do very well. There's a very simple procedure that we could do right there in the exam room. And that's the first step. Yeah.
Yes, I've seen that firsthand. I mean, he's unfazed by it.
Unfazed, yeah.
And it's like $80 or something like that. I mean, it's not cheap, but I mean, it's not for something to get an answer right now and have the question marks that are hanging over your head diminish. It's just incredibly worthwhile.
Right.
And I'm grateful for that tool. So
can I actually ask a question? So a fine needle aspirate, because again, I'm a physical therapist. I'm not a vet tech. I'm not a vet. So fine needle means it's a really skinny little needle. So that's one of the reasons that they tolerate it very well. The aspirate part means that you're removing some cells and you're looking at it under a microscope, right? So,
yes.
So you may be getting to this, but then earlier you said the only way to truly tell is with a biopsy. How does a fine needle aspirate differ from a biopsy? And when does that occur in this process?
Well, I'm not an expert to talk on that. That's for sure.
Kathy,
I can
you may
tell
know.
you my understanding. Kathy's probably have, she will have a better answer.
Yeah. So we will do that's just the first step in this. So sometimes you it's just a syringe with a needle on it, and we'll aspirate or suck out some cells by sticking the needle in and sucking some out and looking at it under the microscope. Now sometimes we can tell that these are maybe they're fat cells, and we go, okay, well, that's a lymphoma. Or maybe we see those little cells that you talked about with mast cell, and we go, this is indicative of mast cell tumor. And then what happens is the next step would be to remove that bump. And actually what we do is, it may be a small bump because mast cell tumors often are very small, but we do really wide margins. So you may
I was going to say, you may actually
see a much larger incision than what you might think, because it's a small cancer, but it might have wider margins. So we'll send that out, and then they'll grade that mast cell tumor. So this is specifically mast cell tumors. There are lots of skin tumors that you can get. This is probably the most common one. And then we'll send it out, and then they'll come back and tell you whether it was a grade 1, 2, 3, or 4.
So that's
and
the
varying on the
actual-
grade will depend on the treatment that follows. Yeah.
So that's the actual biopsy process, is when you are removing, it's kind
We're
of a
gonna remove
2-for-1,
that.
right? You're removing the
We're gonna take
tumor.
that. We're taking that sucker off and send it.
But then you send it in for testing, as with anything. I mean, I know I've had some skin tags removed. You know, you assume they're benign, but the doctor, you know, the human doctor is like, we send in everything, because you just never know. And so that's sending it to a lab, to an expert that actually studies that entire mass and determines what kind of cancer it is, or if it's not cancer, or grading it in the case of mast cell tumors.
You know, Zeke's had a grade 2, and thankfully those grade 2s, typically you remove them, and that's curative. But if they're over 2s, you're looking at a much bigger problem, and you're looking at probably, you know, involving an oncologist and possibly chemotherapy. So I think it's smart to get those off, because just because you had a 2 doesn't mean the next one is going to be a 2.
So after getting back to the reason for all of the, you know, the whole check your pups for lumps and bumps, is that first one really, really shook me, because I was convinced going in there that I was wasting my time, and I was overreacting. And I thought, oh no, we got to do something here, because I've had dogs my whole life since a child. I've never, and I'm not faulting vets, it's just what it is. I have never had a vet tell me, and I've heard this from many people since introducing this little PSA, as you call it. No, I never heard that either. I've never had a vet tell me, check your pups for lumps and bumps. Now, they may have done it when I took them in for their annual exam,
right?
But that's not good enough.
This can be life-saving.
Oh my gosh, yes.
Not only for dogs, but for cats too.
Yes.
To know and be familiar with your pet's body. And I think we're going to talk a little bit more about that too, as we go over how to check the dog for lumps and bumps. But I had one thing I wanted to say, that this makes me think of, we did an interview with Erin, the dog mom. She has a podcast. I think her podcast is called Believe in Dogs. And she has a healthcare journal that you can download. And this is the perfect, yes, is a perfect thing where you can map your dog's bumps, lumps, sizes, if they've changed at all. And then when you come to us, because I've often had people come in and go, my dog has a bump. It's on the elbow, on the inside, close to the shoulder, but not near the elbow, but in the front, near the paw, near the knee. And I'm like, what? And then I can't find it. And maybe it's so tiny, I can't find it. So to have that map of where they are,
yes,
is
for sure.
It's crucial for us and for you to know where those bumps are, so that you can monitor them, is really important. So again, I think that your message is life-saving, and I think that this should be mentioned by every single veterinarian at every single appointment that your pet has, and say, just check your dog over, take your hands, run your dog over your pet's body, and be familiar with it.
When our vet, when I picked him up from his first surgery that day, he said, check this guy every day. And a light bulb went off. And I thought, oh my God, I got to tell the world this. And I thought, oh, I can't tell him to check every day, because that's going to create mass hysteria. So, you know, and you don't want to put fear in anybody. You just want to be able to tap someone on the shoulder and say, hey, did you know you should check your dog once a month? You know, and I just made up once a month just because it just sounded, you know, reasonable. And, you know, now I understand that the Canine Cancer Foundation has a campaign they do on the 14th of every month. They remind folks to check their dogs.
I didn't know that. That's good information. Yeah, the 14th. Okay.
Yeah, they're pretty amazing. So just on the first of every month. So I had a friend create a logo for me that says, check your pups for lumps and bumps. And I created a magnet and a sticker. I'm out of stickers at the moment, and those need to be ordered. But this is the magnet. And essentially, I just put him on Instagram and said, hey, anybody wants a reminder? We're busy. And if, you know, we're not lying to ourselves, we forget, no matter how great of a parent you are. And it's humbling to sit here and admit that I didn't check Gideon as like I do Zeke.
Right.
But I can't go back and change that. But what I can do is affect the future and make a difference and honor him through. And when you said lives are saved, I think of a dog, and I screenshot every DM that I get, and I'm saving it to create a book of Zeke
Beautiful.
when he's no longer with us. And it contains I have a special folder that contains screenshots of all the times people have DM'd me and said, thank you, I took my dog in, it was nothing, or there's a dog named Cruz I'm thinking of right now in New Zealand. So this is a worldwide thing.
Great.
And
it should be a worldwide thing. It should be a worldwide thing, Patty. Yeah.
And I send them for free. I mean, it's the least I can do. It's like $1.25 to send out, and international, I don't care, whatever it is. If we can save a dog, and that's beautiful. That's in the name of Gideon, and that's how I can best. I don't want to say apologize to him, but that's how I can do better as a parent. That's all we can do. We can't spend that energy living in guilt and shame and all get
Yeah,
I have
you
to
made
turn
it positive. You turned it
I have to.
positive.
Yes.
And
I think we have to get better, always get better. The minute we think we're a great parent, or we're a great coworker, or we're a great landscaper, we're in trouble. We can always
we're never done learning. We're never done learning.
Never done learning.
I think this is a great way to honor Gideon. I think this is a great way to honor him.
And
I had a dog. It was my first dog that wasn't a family pet. So when I was an adult and I got my first dog that I could responsibly care for, and this is decades ago now, and she had some bumps, and I took her to the general vet, and I knew this is before I got into canine rehabilitation. I'm an average dog owner. I don't know anything. And they said, we need to do surgery. Okay. And, talk about the aftermath. When I picked her up, I couldn't believe how big the incisions were.
Those deep and wide margins.
Yeah. She actually had 4 lumps removed. 2 were grade 2 mast cell tumors. 2 were like lymphomas or whatever. She lived a long, long life, and, it never returned, but that recovery was difficult. She got a seroma under her incision. She was in so much pain. I remember the bruising and so forth. But, now we know some things to do, like you can provide a cold compress, or, information again is key.
It is.
And I think too, you were talking about, making these decisions with your vet. That is so, so important. We've all said we're not veterinarians. But the more we can share and empower people, the better. Don't rely though on your friends, your family, your neighbors, or the internet to try to make a determination. I want people to hear this, that you never can tell what a lump or bump is. And even lumps that have been aspirated and are benign, and so you agree to watch them, can turn cancerous. It depends, we just never know. In people, there's so much precancerous stuff that is removed because it can turn cancerous. It's on our skin or what have you. And so you're never out of the woods there. And, like you said, the frequency by which, Zeke's lumps showed up, it's never, a one and done. You have to be vigilant. You have to keep checking, and don't make any assumptions.
Our vet actually, on one of them, I don't remember which one it was during COVID, so we had to stay in our car. So I took a picture of it and sent him in when the tech came and got him from the car. I sent the picture in to point it out to the vet. And he's like, I can't find it. I can't find it. I don't see it. It was that small, but it was a mast cell tumor, and he himself couldn't find it. I had to really say, can you please look again? Look at the photo I sent, and really look again, And sure enough, he found it, and sure enough, it was a grade 1.
Yeah. Right. Yeah, they could be small. And you're right. Sometimes you think cancers are going to be they're going to be obvious, but that's not always the case. So I'm wondering, Patty, do you think maybe you could, maybe Zeke could show us how you go over him for lumps and bumps, and show people how to be sort of methodical about going over their dog and where to check on their dog for bumps?
Mhm.
Plus I want to see Zeke.
I think we're all doing it. I'll do that just one sec. We all do it anyway. We don't realize it, except we're just not as comprehensive or thorough. So, because you really want to make sure, because he had one next to his little nub, and the tip of your tail, you don't think to look at the tip of dog's tail. Like, I don't think
or under.
Yeah, or under. I think we could have a dog for 8-10 years and never think to look under their tail or at the tip of it or under or in their, inside of their mouth, which is a big spot, very that can really turn into something if it's overlooked. We just don't think about looking in there, flipping up their gels and stuff.
One thing that I learned as a PT, sorry to interrupt, Patty, but how prevalent toe cancer is, digit cancer in dogs. I had no idea until I started working with animals and then learning through my clients and things, because I don't think that's a common thing in people, and that's the world I came from.
The beauty of this, there's two things, and I'll do that in just one second. But speaking of toe cancer, since you brought that up, in 2020, there's a new treatment for mast cell tumors. And there's criteria to be met, but it's called Stelfonta. And it is an alternative to surgery. So it's like, hallelujah, great. We can avoid anesthesia. This is great. Unfortunately, Zeke has not been eligible for it, but it is one that is, if it meets the criteria, and toe tumors are a perfect one for that, is my understanding. And Dr. Sue is an expert on Stelfonta too. So, if you ever want to,
we might have to get her.
yeah, it's a great alternative to surgery if they're candidates for it.
Yeah, it's good news.
And there's another test called the Nu-Q. It's a cancer screening test, and that came out in 2020 as well. And thanks to Dr. Sue learning about that, I brought it up to my vet, because what it screens for are the big guns of cancer, like the lymphoma, the hemangiosarcoma, the ones that really don't present until it's too late. And this is a screening for it. So I talked to my vet about it. She's like, it was a female one at the time. And she said, I've never heard of this before. I mean, it was brand new, like months old.
Yeah. Right.
And I said, well, can you look into it? Because I want to get this done on Zeke. And it's so, it was about $400, so it was really pricey. And I guess the goal at the time was to make it available. So at a dog's annual wellness exam. Right. But at that price point, that wasn't going to be realistic. It's since come down as of the beginning of this year, and it's about $50 to $75-ish now. So it's reasonable to incorporate now into a dog, especially these breeds that are predisposed to it. I mean, to recommend that would be silly. So it's a blood test. That's all it is.
Yeah. And I'm taking your dog's blood anyway. I'm getting you're doing your heart rate testing.
Exactly.
Well,
yeah.
Take a little extra
send it off
and screen. Exactly.
And
Simple.
It's so relieving to know, okay, he doesn't have lymphoma right now, or he doesn't have those, big cancers. So I'm very grateful. And that's another way that Zeke has been able to help other dogs, because now our vet, I mean, she would have learned about it at some point. I'm not saying we educated her and enlightened her, but they're also incredibly busy and overwhelmed too.
Yeah,
so
she got her to the finish line faster. Exactly. Now she knows. Yeah.
Exactly. Yes, absolutely.
And then just like your campaign, each person that you tell something, it's exponentiates, it's like bunnies breeding and having babies. It's like one turns into two turns into four turns into eight.
Fast. So fast. So fast.
I'll pause it here while you get Zeke. All right, so we're back with Patty and Zeke, our model. And Patty, you're going to show us how you check Zeke for his lumps and bumps.
Yeah, it's, we already do most of it and we don't realize it. But being mindful once a month to do the, more thorough than just, the pets that you do during cuddles and nap time and stuff.
That's what I say about massage, is that you're just more mindful versus just randomly kind of petting them. So it's that mindfulness and paying attention to what you're feeling.
Yep. And I always have treats and, just check every, area that you normally aren't touching. And then, looking at his gels and
you're really listening with your hands, but you're visually assessing too.
Yes.
Yeah.
Absolutely.
And he's a short-coated dog, but those long coated dogs, it's harder to see things, if they're
Yes, you have to really feel your way through it. And especially in the lymph node areas, you really want to make sure.
So where are those lymph node areas for our audience that may not know?
Kathy.
Well, yeah, definitely those armpit areas and under the groin, in the groin area. There's actually even there's a popliteal, I think that's at the like
Back
where the
of the
hock
knee.
is. Yeah, back of the knee.
Yep.
Any of those firm swellings. So you started at
And
the
along
head.
the throat.
I start at the head from nose to toes. Yeah.
Yep.
Yeah. And I go all the way down. Like when I do his head, and I work on the first half of the body and then back. But literally, just looking in between his toes. Sometimes I'll do this in a bathtub too, because he enjoys a bath with peanut butter on the wall. And
Good.
Yeah.
But the between the toes, I look and put my thumb and just feel too, because our eyes can deceive us sometimes. So, and then just feeling everywhere and looking. And I'm also checking the spots too that he's had previous tumors removed. The one here that was a grade 2.
Can you? I'm sorry. Can you? Yeah, just change your screen a little bit. There we go.
Yeah.
Okay.
This one, there was one right here. This was his first one. And it was a grade 2. And so I was told that there's a 20% chance of it coming back. So I'm always really mindful of that. And there's a subtle scar. So I'm always reminded of that spot.
And he doesn't care at all. Look at him. He doesn't mind it at all.
No, he doesn't mind.
Well, that's with anything. You want it to be positive. If he needs a break, you give him a break and then you resume. Maybe it's in a minute, maybe it's tomorrow. What I'm hearing from you too is, you said from nose to toes, head to tail, is being methodical so that you don't miss places. So it is important to feel everywhere. And so kind of getting into a routine that the dog appreciates, they know, oh, it's not unfamiliar to them. This is happening on a regular basis. And I think, dogs in general are creatures of habit. And so when you are in the same routine and how you touch them and feel them, maybe even the place that it is, maybe you go to the porch or like you said, the bathtub, and that gives a stimulus cue that this is what we're doing now.
Plus when he's wet, I can see
success.
I can see the skin better too when he's wet.
Yeah. And don't be embarrassed to check spots that you're like, oh, I don't want to, get near his prepuce or his bum hole. But actually, there are tumors that can occur on
absolutely.
Prepuce.
Yes.
There are cancers that can occur on the anus, and there are cancers in female dogs that can occur on the nipples. So don't be embarrassed. Like really check
and male dogs on the nipples,
and male dogs as well.
Yeah. And the big one too, I would say, in my experience, hasn't been feeling. I haven't felt them as much. Most of the time, maybe even every time, it wasn't through feeling, it was by seeing it. So don't just look and watch TV. Don't just feel and watch TV. I would have missed them. I think almost everyone that was the case. That means they we're flesh with the skin. So if you don't look, you could very well be doing it in vain.
Right. You might miss it.
So how did you see it, Patty? Are you talking, we've talked about mapping lumps and bumps, but I think there are also color changes, qualitative things that may not be normal in the sense that maybe it's a scaly or calloused area that you wouldn't normally expect to see on the rib cage or something. Is it mobile or is it really tightly adhered? These are qualitative things that you can then bring to your veterinarian. Again, I read a research article years ago that trained veterinarians couldn't even tell by feeling and seeing, but that gets you to that next step. And so, I've heard people say, oh, it's soft, so it's not cancer. It's mobile, so it's not cancer. That is not true.
Yes,
we can't emphasize that enough.
Or it's too small, or that's the. Now I do understand, Kathy, you can probably say this better than me, but it's my understanding that the reason why it's best that it's a pea size, at least a pea size, is because anything much smaller is nearly impossible to get a good aspirate out of.
That is very difficult when it's flush with this skin. And at the practice that I work with, if we found something like that, it's likely that we would just probably move right to biopsy and removing.
And we've done that too in another case.
Because it's just too,
it was too
flush.
small to remove, but it was too risky not to.
But it was too risky not to, and we would probably just go right into taking something like that off. And like you said, we would get large margins, but larger margins and take that off. So yeah, if they're flat and flush, it's hard to like suck the cells out of something that's flat.
And that's why you have to look, not just rely on palpating them.
I have a little story with Baxter, in that I'm embarrassed to say this. I noticed a little bump on his chest. I know it's there. I looked at it. It's not an abnormal color. It's very small. In fact, it kind of felt like a tick, and that's why he's fluffy. I had to part the hair and really look at it. And I'm like, nope, that's his skin. And I didn't do anything about it. When he was in for his annual exam, the vet tech that was just holding him gently for the doctor, she's like, oh, I feel a bump here, because it was right on the front of his shoulder. And I go, oh yeah, that's been there, it's nothing. Well, again, how do I know that?
Right.
So I've learned so much. But what they did is they took a picture of it. They had this special tool, like a caliper or something.
Yes. And measured it.
And measured it. And, so now we have, where it is, the color, the size. Then he went in for another procedure, probably 4 months later. It wasn't long. And the vet's doing it again. And I'm kind of chastising her. I'm like, you just checked that 4 months ago.
Check it again.
But she measured it again. And then we were happy to, she reported that it hadn't changed in size or anything. So this vet has recommended, based on, again, breed and history and so forth, that we are going to do kind of a wait and see.
Yes.
And that brings me to a point too, that every breed has their things, that, and oftentimes there may be a cancer that is associated with that breed. Could be cruciate tears. It could be eye issues. It could be deafness. But oftentimes there are maybe some correlations with a breed and a specific type of cancer. I know I learned working in this field that, like the Scotties, the Scottish Terriers, I think they're called, and Westies, the West Highland Terriers, have a very high predisposition to, I think it's TCC or a bladder type cancer. And, so you wouldn't be able to feel that. But again, if they started acting abnormally or something, then what's the vet going to do, Kathy? Probably ultrasound, right?
Oh gosh, blood work, urinalysis, ultrasound. Yeah,
right.
We would do the workup.
So you do a series of tests to then determine. And, in this podcast, based on Patty's experience, we're talking about the lumps and bumps that one feels, mast cell tumors and other things, but it could be, all kinds of things. So,
which is one of the reasons why they're so highly treatable, because you can see them. You can't always see the lymphoma at its early stage. He was a week from death.
Yeah.
And animals are they're really good at masking a lot of those symptoms too. They don't want to, especially, some of these breeds are particularly stoic, and you're not going to see that they're going to show anything until they're sick, right? Until they really feel sick. Sometimes, with these hemangiosarcomas, I'll have owners, and I can't tell you how many times I've heard this. The dog was fine yesterday, collapsed this morning. It's exactly how it happens.
Right.
And I can't recommend that NuQ enough.
Because, but the good news is we're doing better with cancer now than we ever have before. And I think a lot of that is in part due to the owners, right? Who are saying, like you, Patty, check your dogs for lumps and bumps, or bringing them in and checking for lumps and bumps. We also have better treatment protocols now than we did, 30 years ago. And so dogs, dogs and cats, if we can catch these things early, that's our best hope for the best possible outcome, is to be able to get these things. It's just like people, as early as we possibly can.
Early detection saves lives.
Detection saves lives. Exactly.
I also want to emphasize, Kathy and I, in preparation for our chat today, Kathy, Patty, sorry, Kathy and I were talking about how we were always
So
See, it's
cute.
not bad. It's not bad to be
Yeah,
checked.
he's relaxed.
It's not
That's
at
fine.
all.
I got some loving, I got some rubbing and some pets. That's all good. Attention is always good. But to that point, Kathy and I were talking about how stunned we are at the amount of owners, pet owners, that live with their dogs, love their dogs, coexist with their dogs, take their dogs to activities, spend a lot of money on their dogs, but don't really touch them. Don't really
Hands on them, right?
feel them. Yeah. Or maybe, you know, a little pat on the head,
Exactly.
or,
Right.
you know,
Right.
because that's not my world. That's not my reality. And so,
Sure.
so yeah, just pointing that out, that you know, I know you're out there. I know that, you know, there are people that actually have a fear of touching their dogs to the point that they might cause discomfort, whether it's physical discomfort or emotional discomfort, right? Like, I don't want to touch my dog there. That's too invasive. You know, they're not comfortable with that. They always walk away. Sure, you know, note those things, but how can you make it positive? You mentioned, you know, the peanut butter on the wall kind of thing, because it could be a matter of life and death.
Right.
Absolutely.
So
Absolutely.
touch your dogs.
You can
Yes.
also, you can make this a positive experience. It doesn't have to be a stressful event. And we have a faithful listener, a friend of ours, Ellen, who's probably listening to the show as we speak. And she's given her dog the command, "Let me see." And that's the command for the dog to just relax and let her look at the dog. I can't tell you how many times it's come in handy for me when I'm treating her dog. Let me see. And the dog knows exactly what that means, and she gets rewarded for that as well. So it doesn't have to be a stressful experience. You can set yourself up for success with praise and food and a calm demeanor,
And taking it
or
slow.
cue. Yeah, take it slow, or
Give them
look,
breaks.
or yeah, exactly. Or examine your dog in quadrants. Maybe you looked at the shoulder and the head in the morning, and you check the you know, the bum and the legs in the afternoon.
Kathy, it's funny you talked about let me see. My mom, because she's a mom, I guess, even to her dogs, she goes, and her cats, "Mama see, Mama see." And so whenever she wants to, you know, look at something, whether it's, you know, she has 2 cats currently, but I think they associate that when she says "Mama see," then they know she's approaching and she's going to be handling them and looking at something, you know. So
and you could come up with a sign for it. Let me see, or you could come up with some, you know, sign for that. So I think setting yourself up for success is a good, you know, it's good. It's going to be helpful, beneficial.
With the spicy dogs, you know, I'm sure there are people listening and saying to themselves, because it's overwhelming to have one. I mean, it is a thing that no one is prepared for and no one signs up for. But if you are a real, I mean, a lot of times actually, you know, I would say more times than not, they end up right back at the shelter. But if you know, we're working with a force-free trainer, she comes to our home, she's amazing to help Rosella. It's worked a lot. I can't remember the name of the doctor you had on, but she is a behavioral analyst.
Oh, Terry
Bright.
Yes,
Bright.
Terry. Yes. You know, and she talks about desensitization and counter conditioning and stuff. If there's nothing else other than if there's only one thing you work on, counter conditioning and desensitizing your dog to, if they don't want to be touched, it's being touched, because it could save their life.
Yeah. And just making vet exams
and then that
reasonable, you know.
Yes.
You know, at the very least, you know, they have to palpate their abdomen and, you know, their limbs and things like that. And, you know, we also had somebody on about muzzles, and, you know, we try not to use them, but if they're needed, they're needed. But again, if things are introduced in the right way and it's not a frightening experience for them, then, you know, that's one less step. You know, we don't have to muzzle them. And yeah, so, and create,
you know, trust, and honoring that trust and respecting that animal and getting consent and showing them that this is, you know, the muzzle's okay to wear. It doesn't mean anything.
Oh, yes. Big advocate of muzzles. Yes.
Right. Yeah. And yeah, we're always talking about new and better ways to do things for animals that are within their consent or fear-free.
People,
Yeah.
Patty, about where to find you, where to access Zeke and Zella on Instagram to continue to get your positive messaging and education.
Yes, we have an Instagram. That's all we have. We're not on Facebook or anything. It's all I can do to keep up with Instagram. So I do work full time and do a couple of side things. So and we're always learning and training, especially Zella. So I just have an Instagram, and that's Zeke _and_Zella, ZELLA on Instagram, Zeke and Zella. And if you want a sticker or a magnet, I would love to mail one to you, no matter where you are. Happy to send internationally, wherever you are. Just DM me and ask. If it takes me a minute to respond, sometimes if you have never communicated with me before, sometimes it's going to a different box. So I'm trying to get better at learning to open those up too, because I'm seeing that some of the requests that come through for the stickers or magnets are getting thrown into this, like, I guess, a spamish box. But I'm
looking at your I'm looking at it right now, and you can go to they have a campsite bio that you can go to and look at everything too there, right? Yes, you could just follow the link in the bio.
And we have some information we put on there about at the link in our bio about mast cell tumors, and a link to the Canine Cancer Foundation too.
Good job,
Right.
Patty.
And we'll put all of that information as far as Instagram and such. And maybe when we get offline here, you can send me the contact information for the oncologist that we would like to connect with, and we can put her information on the show notes too, if she's open to that. So check with her. So well, thank you so much. I made a new friend.
Patty. You're doing good work.
Thank you. You guys are, I'm so honored. Seriously, I'm not just saying it when I said you were my top 3 fave podcasts. We all have a top 3. And so you made it. You made it.
Behind the velvet rope. Yes.
My other 2 are completely unrelated to dogs.
And I think we can call Patty a super fan.
I think so.
So we don't have many super fans. So
you're doing me. You're doing me.
Thank you,
all right. Bye, Zeke and Zella. Thanks, Patty. We'll be in touch.
All right. Thank you
my
so
God.
much. Take care.